The numbers alone are astonishing.
If Black Americans were dying at an equivalent rate as white Americans, what would that mean? And to date, it would mean 13,000 Black lives would have been spared.
Andy Egbert with American Public Media's Research Lab says that across the country, Black Americans are dying from coronavirus at twice the rate of whites, Latinos, and Asians.
And so those are, mothers and fathers and grandparents and bus drivers. And, it makes my heart ache.
But in the nation's capital, the disparity is much worse.
It was just astonishing to me.
I mean, sadly, the magnitude of the disparity is greater in DC than anywhere else.
While DC's population is 46% Black residents make up at least 75% of all coronavirus deaths. The DC Department of Health reports that at least 346 Black residents have lost their lives to COVID-19, compared to 53 whites.
So it's exceptional in a real negative way. It's something that we've seen over many weeks, so it's not kind of a hiccup in the data. It's a fairly, durable pattern that we're seeing there.
The Nonpartisan Research Lab started crunching the numbers once the racial disparity started to appear early in the pandemic.
From the beginning of our reporting back, less than 2 months ago, we had lost about 15,000 Americans to the virus. Now, as we all know, we've exceeded 100,000 lives lost. But the deep inequities, especially for Black Americans, have been there at every point. At every kind of mile marker, we've seen the same conclusion.
They also found the racial divide was not exclusive to big cities.
Because we also see Kansas right up there, which is not known for its cosmopolitan centers, right?
Egbert hopes that by tracking the localized impact of the pandemic, communities can better target their response.
Just across the river, it's almost the difference between life and death. More Black people have died in DC than in all of Virginia.
I think that is one of the most painful things about this, how localized the losses have been. I think it can be something that can help us, give us something in our toolbox, right? So let's get, feet on the ground working in those communities.
Whenever the world is suffering times 10, we'll suffer times 20.
We've always been concerned about our health disparities and issues. We really have to address the social ills facing our community.
A new crisis is shedding light on a persistent problem in the nation's capital.
I instinctively knew, what things were going to look like once we started getting the data.
Andy Egbert with American Public Media's Research Lab says that across the country, Black Americans are dying from coronavirus at twice the rate of whites, Latinos, and Asians.
It makes my heart ache.
But DC has the highest disparity in the nation.
And we'll suffer times 20.
Black DC residents are dying at nearly 6 times the rate of whites.
When are we going to stand in the truth that a lot of the things that we're seeing, these disparities, have a direct connection to this country, DC's legacy of racism?
Quabila Huddleston is an analyst with the DC Fiscal Policy Institute.
Our main mission is to promote prosperity and success for all DC residents.
In April, Huddleston and a colleague published a series of blogs for DCFPI focusing on the Black burden of COVID-19, a pandemic she says has been made worse by systemic inequality.
Why do you think that is?
DC has this long history of residential segregation, relegating Black folks to manual and low-wage jobs.
The Institute says the district also has the highest wealth gap in the country. A report shows that white families in DC have 81 times more wealth than Black ones. Another problem? Access to quality nutrition.
In Ward 7 and Ward 8, there are only 3 full-service grocery stores that are supposed to serve over 160,000 people, right? And then you go, west of the river, and in Ward 3, there are 9 grocery stores, and they have about half of the population.
So what can be done? Huddleston says the people need to demand action from district leadership, and they have proposals to help address the divide, like ensuring paid time off for essential workers.
The city owes it to those folks to pay them some essential duty pay.
Also, eliminating DC's qualified supermarket tax incentive and invest in supermarkets in wards 7 and 8.
We're literally losing out on millions of dollars.
And address disparities in both access to and quality of healthcare.
You know, DC needs to prioritize anti-racial bias training for medical professionals on the front lines now, but also as we move forward.
Above all, Huddleston wants everyone to be vigilant of their own well-being.
We all just have a responsibility to remind our policymakers that the pandemic isn't an excuse to not make progress, right?
An updated reporting reveals that East D.C. is seeing some of the worst of that disparity. 7 on your side's Adriana Hopkins shows us that some desperately needed help could be within reach.
We'd all love to be done with this virus, but it's really not done with us.
Since the spring, American Public Media's research lab has taken on the task of breaking down the U.S. COVID-19 death rate by race, and with sobering results.
If blacks and whites were simply dying at the same rate, 16,000 Black Americans would still be with us.
But out of the DMV region, in fact, out of the entire country, the District of Columbia is seeing the absolute worst of this disparity.
I mean, sadly, the magnitude of the disparity is greater in D.C. than anywhere else.
Black people in D.C. are dying from coronavirus at a rate roughly 6 times higher than whites.
Well, why are you all shocked?
I instinctively knew, what things were going to look like once we started getting the data.
For a former mayor and a policy analyst, the news is not surprising.
Dying more.
Quibila Huddleston and the D.C. Fiscal Policy Institute are suggesting things like essential duty pay and improved access to health care to help ease the underlying causes of this racial disparity.
It's the fact that they're living in food deserts and have been for years and don't have quality health care. And Black D.C. residents in particular have been forced to work low-wage jobs.
Former mayor and current D.C. council member Vincent Gray hopes that soon he can finally accomplish a years-long goal of bringing a new hospital to St. Elizabeth's East in Ward 8. And that's not all.
So this has the opportunity to create the first ever healthcare system in Ward 7 and Ward 8.
That proposal would also bring the first 2 urgent care centers east of the river to serve more than 160,000 people, nearly half of D.C.'s Black population.
This is going to be I would say a game changer.
Gray says the council will vote next Tuesday on the hospital plan, and if it passes, we could see the urgent care centers within a year and a new hospital by 2024. Adriana Hopkins, ABC 7 News.
Is on your side tracking a deadly disparity in the district. Now, this is the COVID-19 death rate from June to November. Take a look at the lines as they continue to go up. And as you see, while the rate for white residents has stayed relatively flat, the rate for Latinos and especially Black residents has climbed steadily. Now, for months now, researchers have said that disparity is the worst in the country.
But long before the pandemic, district leaders and advocates have been working to address the underlying causes. Tonight, ABC 7's Adriana Hopkins shows us why hope for change could come with the newly passed REACH Act.
The numbers make it clear.
As coronavirus cases continue increasing here in our area,
it is getting worse.
I'm really scared, actually.
COVID-19 infections in D.C., Maryland, and Virginia continue to rise, but in every jurisdiction, Black people are dying at a disproportionate rate.
I'm deeply concerned.
And in the District of Columbia, the disparity stands as the worst in the nation. Data from American Public Media Research Lab shows Black residents are dying from the coronavirus at a rate 6 times higher than white residents.
Black residents account for roughly 46% of the district's population, but thus far, throughout this pandemic, approximately 75% of the COVID-related deaths have been Black residents.
For more than 6 months now, someone on your side has been trying to find out why.
This country, DC's legacy of racism.
African Americans throughout our entire country, and it's no different in the District of Columbia, have suffered at the hands of years of government-sanctioned discriminatory policies that help to create the disparities that exist today.
Ward 5 Councilman Kenya McDuffie and groups like the D.C. Fiscal Policy Institute have been working for years to tackle the underlying inequalities that are now fueling the deadly COVID-19 disparity. And in November, that effort took a big leap forward.
The declaration is approved unanimously.
The D.C. Council unanimously passed the Racial Equity Achieves Change, or REACH Act. That bill is designed to integrate racial equity into how D.C. government operates.
Looking at the disparities that exist and to see how the things that we are implementing in our city are working to close those disparities.
Provisions included a required racial equity impact assessment on council measures, establishes the Office of Racial Equity under the mayor, requires racial equity training for all D.C. government employees, and adds a layer of community oversight.
There's going to be a council commission on racial equity.
DCFPI's Donnie Crawford is part of a coalition that lobbied for the REACH Act. Now that it's passed, she hopes substantive change will follow.
I hope that it's not just fluff. Try to make sure that Black people are taken care of the same way the city takes care of white residents west of the river.
What may be the most important aspect of the REACH Act is that the bill was funded before it was passed, ensuring it could go into effect despite current concerns over D.C.'s budget. Adriana Hopkins, ABC 7 News.
You can see the state-by-state COVID-19 numbers for yourself and see a list of provisions under the REACH Act in our full report up on WJLA.com right now. It's a disparity that doctors and health advocates in the DMV are seeing up close and personal.
She called me crying, almost hysterical. She had the virus. I can hear it in her voice.
Latino communities being disproportionately impacted by COVID-19.
Health equity, health disparities, and health literacy, all coming to a forefront.
In D.C., Maryland, and Virginia, the number of Latinos coming down with coronavirus outpaces their share of the population. But when it comes to who is dying from COVID-19, there is a much deeper divide hiding in the numbers.
Despite being quite a bit younger, Latinos are dying more than we would expect.
Andy Egbert and American Public Media's research lab have spent months breaking down data on coronavirus deaths based on race. Now the death rate is also being adjusted for age.
We went from Latinos being kind of having the second highest death rate when in the case of Virginia, to having the highest death rate when we consider age.
In fact, in Virginia, when adjusted for age, Latinos have a death rate 4 times higher than whites. The same in Maryland, 4 times, and the death rate is 6 times higher in D.C. So why is adjusting for age important? Well, Egbert says Black people, Latinos, and Asians tend to be younger on average than white people. And with older people being more at risk for coronavirus, taking age out of the equation helps us focus on other factors leading to the disparity.
Despite being quite a bit younger, Latinos are dying more than we would expect. Well, it means that the exposures are coming to people who might be taking the bus or the subway. It might be someone who's getting exposed in their workplace.
These families that are forced to live in small spaces don't really have anywhere to go.
And that's something we absolutely need to pay attention to and respond to, and the interventions might be different.